Hi, this is QD Clinic. I'm Jack Cush with Room Now. QD Clinic is brought to you by Room Now Live, March 2021 in Fort Worth, and live streamed to you. So today's case is hurts all over. Seems like we talk about this a lot. We should continue to talk about it. Saw a 37-year-old gal who came in, and in her first line, she actually told me what the diagnosis was. I'm not going to tell you that line. I'm just going to tell you that she hurt all over, mostly limbs and arms and legs and feet and hands and back and neck, and hurts all over, shoulders, elbows, wrists, whatever. So that falls under the category of algias, both arthralgias and myalgias. It doesn't really seem to matter in most cases whether it's more arthralgia, a little more myalgia. To me, I think it's the same bucket. And I think the question is, what's the differential diagnosis? Um, I think, post-viral influenza, we all, if anybody's had influenza, uh, and or had a reaction to a vaccine where you feel flu-like, you know what that feels like. Sort of deep muscle soreness and whatnot tends to be diffuse, can be joints as well, can be tendinopathy, can be myalgic, so I think that always should be considered. But in fact, there are very few cases of people that will have sustained, continued algias that are post-viral. Um, I always teach, and I've occasionally seen a case of endocrinopathy causing algias. So that would be disorders, high or low, of thyroid, adrenal, and parathyroid glands. Can't say that I've seen much of that. I know that we all do TSHs on all our patients, and honestly, has that ever really panned out or paid off? The return on that's about 1 in 3,000, but you should still consider it. One of the best known and most easily diagnosed is polymyalgia rheumatica, but that's not really hurt all over. That's usually more proximal, shoulders, neck, upper extremities, hips and legs and lower extremities. Not down to the feet, but sort of like between the knees and hips, not uncommon. They got stiffness, they got, the labs. It's not a hard diagnosis. But our gal, as I said, she's in her 30s, so this is unlikely. It could be the early onset of connective tissue disease, but I always contend that while that may be an unusual presentation, by the time that is their presentation, it is usually likely there is other evidence in play. They will have rainouts, they will have dysphagia, they will have had, rashes and swollen joints, and where it's not going to be hard to diagnose lupus, RA, systemic sclerosis, myositis, spondylitis, etc. Your greatest worry, of course, is that it could be a cancer. And how often does paraneoplastic manifest with diffuse pain and algias? Actually, not that commonly. They're more likely to present with focal, oligoarticular, sometimes polyarticular joint problems, but widespread, not likely. Hypophosphatemia on the list, can't say I've ever seen it. Um, Hypermobility syndrome, a young person presenting with pain and all over. You should always ask them, can you do any circus tricks? Can you dislocate your shoulder? Can you bend over and put your palms on the floor? I once had a patient, a young guy, 17, came with his mother and his sister, and you know, it looked a little like fibromyalgia, but I wasn't really too sure. And at the end, I wasn't really clear what it was. And then his little sister said, "Show him that thing you do. Show him that thing you do." And he said, "No, no, no." I said, "What's that thing you do?" And he grabbed his Adam's apple, and I kid you not, he took it and pulled it out like about 3 inches to the right, and it sprang back into place like a spring, and it was almost like a Wile E. Coyote cartoon. And sure enough, he had hypermobility, had Ehlers-Danlos. Pretty interesting. Speaking of hypermobility, Ehlers-Danlos, it runs with, fibromyalgia, hypermobility, Ehlers-Danlos, POTS. These are all kind of the one and the same although there may be different pathways into the game, they all pretty much the same. There's sleep disorders, amplified pain, etc. This patient told me in the first visit she had recently had surgery for a Chiari malformation. That's the Arnold-Chiari malformation. There's a few different types, but basically you get a near herniation of the medulla down through the foramen magnum, and it is that compression that is very often associated with fibromyalgic-like manifestations, extreme fatigue, made plus or minus neurologic manifestations. When they are of a certain severity and type, they are correctable by surgery. Interestingly, patients who've had Chiari malformation surgery, in my experience, do not have resolution of their fatigue, fibrofog, widespread pain in muscles and joints, and the game goes on. So while most people who have pain and fatigue probably have depression, a sleep disorder, and fibromyalgia, there are other disorders that can also get you in the game, and those latter few I mentioned, the Chiari malformation, the hypermobility, and the Ehlers-Danlos, and POTS, the postural orthostatic hypotension with tachycardia syndrome, they all seem to run in packs. So you should look for them in packs. When you see one of those, you should think, is this a sleep disorder and fibromyalgia as well? That's my case for the day. Tune in tomorrow to hear more about great cases from the clinic.